Hi there. Welcome. Do you have an appointment? Perfect. What time? 11. Let me just quickly check my books. Yep. You're with Dr. Hawthorne today, is that correct? Perfect. Well, before you go in, I'm going to have to take some of your details, if that's okay with you. All right. Could I have your full name, please? No, that's not so difficult. Perfect. And your number, preferably one that you use quite often, in case we have to contact you. Nothing too serious. Yeah, 75. Great. And now your email address? No, that's quite fine. I used to have a very silly email address when I was younger too. Okay, great. Well, let me just buzz Dr. Hawthorne. You can go and take a seat in front of room 4. He will call you out when he's ready, so in a bit. And don't forget to check in with me before you leave so we can discuss payment or if you need to book a new appointment or like a follow-up. Yeah, so we can discuss that afterwards. Okay, great. Yeah, go take a seat, have some water, and feel at ease. The doctor will be with you soon. Okay, great.
Hi, okay, have a seat. Good to see you. I suppose Charlie took your details. Fantastic. So tell me a bit about what the problem is. Okay. Okay, so you've got a bit of pain around the ears and a bit of inflammation, it seems. Okay, do you have any trouble hearing at all? Just a bit of itching. Okay. And you mentioned a bit of pain around the scalp region. What exactly is going on there? Oh, so a sort of tingling sensation and sort of scratching. Well, it's certainly something we can look at here. That's absolutely fine. Okay, so seeing as it's your first time, we're just going to dive straight into the diagnosis, and it's going to be a pretty routine checkup just to see that the surface condition is okay, and if we can, maybe identify some deeper causes or some deeper problems. Now, I'm just going to put my gloves on. Okay, and is it okay if I come a little bit closer to maybe inspect your ears? We'll start with those. Excellent, okay. We'll start off with your left ear. Okay, so I'll just come a little bit closer, have a look inside, and have a look in there. Okay, that all looks fine. I can see there's a bit of redness there, and it's a little bit sore from where I see you've been scratching it as well. But that's certainly nothing to worry about. We have ointments for those sort of things, and a balm that we can give you there. Okay, so now I'm just going to take a look in your other ear to make sure that the condition is consistent. Okay. Yeah, I see it's a consistent condition. We have the same sort of redness and sore patches in this ear. And does this hurt if I press here at all? Okay. Do tell me if I need to be a bit more gentle. Okay, well, the good news is everything seems fine. However, there was a slight patch in the right ear that I'm not too happy with, if I'm honest. But we will take a closer look at that in just a moment. I'll have to get a special tool of mine. It's nothing to be afraid of, but we can certainly have a closer look. Okay, so now that we've had a look at the ears, we'll just carry out the scalp examination. Now for that, I just need you to sit back slightly and just relax, and I'll have a look at that. Now, you mentioned there was some irritation around the scalp region. Does it hurt if I press here at all? Okay. And how about if I press over here? Touch here? No? Okay, that's a good sign. Now, let me just take a little closer look inside the hair. Okay, everything seems normal then. Have you had any urges to itch or scratch whilst you've been sleeping, or have you been woken up by anything? Okay. And how often per night would you say that was? Just 2. Okay. Okay, so let me just take a few notes of what I've seen. Okay, fantastic. So what I want to do now is take a closer look at those ears. Now, as I said, there was a bit of irritation that didn't seem normal, or that didn't seem to be something that we could take care of with just some standard balms or ointments that we have here in the clinic. Now, unfortunately, I am personally not qualified to carry out that examination myself. However, I do have a colleague who's in the clinic today who'll be able to carry that out for you. Is that something that you're happy for them to do? That's great. So let me just go and get her for you, and she'll bring along the necessary tools, so just sit back and relax, and we'll be with you in no time.
Hello, I'm Dr. Miller. Nice to meet you. I'm sure Dr. Hawthorne has already performed a sort of primary examination, but I heard that I was called in for sort of specific things to look at your ears. Yeah? So I was told that there was some pain and some redness, maybe some inflammation around the ears and inside. Yeah? How long has this been bothering you? Okay. Do you feel the pain anywhere else? Like, does it radiate around? Okay, that's a good sign. Okay, well, if you don't mind, then I'm going to get my horoscope and I'm going to take a closer look into your ears. This shouldn't be too intrusive, but if you feel any pain, please do let me know. Okay, so I'm going to start with this right ear right here. Okay, let me take a look. Good. Okay, yeah, I do see this redness, and it's a bit patchy even. Yeah. Okay. Is this uncomfortable for you? Okay, good. I'm gonna insert the horoscope now. If that feels uncomfortable, please let me know. Okay. Yeah. Okay, well, what I can see here is that the problem isn't very deep, which is a really good thing. Yeah, okay. Now, this is definitely something that we'll have to treat, but it shouldn't be anything too severe. All right, okay. Now I'm gonna check your other ear. Okay, taking a look. Yeah, just on the inside. Yeah, it looks, this ear is a bit worse than the other one. There's a little bit more patchiness on this one. Okay, let me just take my scope. Yeah, okay. Okay, let me, I'm gonna pull on your earlobe just a little bit. Okay. Yeah, I see that the problem isn't very deep here either, which is a good thing. Okay. Alright. Okay, seeing as there are some problems with your ears, I think that it's wise to get some medication on the way and to just get rid of this problem. You said it's been quite itchy and quite nasty for a while now. Yeah. Have you been to a swimming pool lately? Just trying to sort of figure out if that's the cause. Yeah? Okay, well that might explain it, yeah. Especially if you have really sensitive ears, that could really be the case then. Okay, well I'm just going to prescribe you medication that you take, pills, and also a cream, which will hopefully soothe the itching. Okay. Yeah. Well, thank you for coming in. Also, it's good that you've come in so quickly that this problem hasn't become substantially worse. I'm going to head off now. Here is your prescription. but I will leave you in the very capable hands of Dr. Hawthorne. It was very nice to meet you. I hope that your ears feel better soon.
Okay, I hope that all went well for you. I hope it didn't hurt too much. I do know Dr. Miller is actually quite gentle, and we've had some really positive reviews of her. Now, okay, I see you've already got the prescription. That's perfect. I suppose the next stage really is just to see how the treatment goes, and then book yourself into a follow-up appointment with myself. If I'm not available, of course, Dr. Miller will be more than happy to see you. But you can book that with the receptionist, Charlie, outside. That would be absolutely fine. But that's it from my end. Have you got any further questions today? Okay, well, it was very nice to meet you, and hopefully you feel better soon.